Hello, welcome to the Emerson, to the medical Licentiate Emerson channel. So we are continuing with our anatomy and physiology lectures. So today we are going to go through the principal skeletal muscles. Okay, so we are continuing with the principal skeletal muscles. Okay, so let's move. So your objectives for today are going to describe the origin, insertion, action, and innervation of the muscles. We're going to learn the names of the principal skeletal muscles in the various regions of the body. Also going to explain 7 features used in naming skeletal muscles. Okay, so especially you have to know the features, or you have to know the mechanisms, specifically the features that we use when naming skeletal muscles. Okay, so let's start. So there are various ways of naming skeletal muscles, or various modes or ways of naming the skeletal muscles. Number one way is the location. Okay, so location we have where we say whether it's brachialis. So brachialis, we talk about the arm. Remember the arm is also known as the brachium. So muscles of the arm have the name brachialis. Okay, then we have in the temporal region, okay, on the temple, we have muscles that are found there are known as temporalis. Okay, then in terms of shape, okay, so the shape of the muscle, okay, if it's looking triangular, then we call it deltoid. For instance, the one on um, the one on the arm, okay, we have the deltoid muscle there, okay, on the lateral aspect. Then trapezius also have it looks like a trapezium, so we call the muscle trapezius. Okay, and then we have the relative size. So relative size, for instance, we have minimus, maximus, longus, and brevis. Okay, minimus, maximus, longus, brevis. Okay, and then you have direction of fascicles. Okay, so what's the direction of the fascicles? Okay, so for instance, we can have oblique muscles, meaning the fascicles are in oblique, Then rectus, when the fascicles are straight. So you go it rectus. So rectus is when the fascicles are straight. Then you have location of attachment. So where is the muscle attached to? Okay, so location of attachment. So we have brachioradialis. So this is an example. So of course these are just examples, meaning there are actually a lot of examples. Also, we can have number of origins. So number of origins, number one, we can have biceps. So meaning there are 2 origins. Quadriceps, so meaning there are actually 4. Then triceps, 3. Okay, so for instance, biceps and triceps can be found on the arm. Okay, so we have the anterior part where the biceps are, then posterior part where the triceps are. Okay, then in terms of action, so what is the action of the muscles? For do they flex, do they abduct, do they extend? So those that flex, we call them flexor muscles. Those that abduct, they call them abductor. Then those that extend are known as extensors. And I remember there's some for abduction, we know that it means away from the midline. So other people usually remember it from the word abduction or kidnapping. Okay, but we don't call them kidnappers. Okay, so they are abductors. Okay, but again, remember this is terminology that you actually need to actually even understand. So meaning a kidnapper, you can also call them an abductor, since they actually take someone away from their home. So even a mouse that goes away from the midline, so that's the home. So away from home, we call them abductors, but of course not kidnappers. Okay, so 9 or 8 we have origin and insertion. So example would be the sternocleidomastoid muscle, so origin and insertion. Okay, so I think we can move on. Okay, so we go to the group functions of skeletal muscles. Group functions of skeletal muscles. So number one group function is the agonists or prime movers, which are the main muscles activated during movement of the body. Then this one actually contract actively to produce desired movement. And the way I remember agonists is that actually they are the muscles that involve in movement of the body. Then antagonist is the opposite. They actually oppose the action of prime movers. So they oppose the action of prime mover. Okay, they oppose the action of the muscles that move the body. So as the prime movers contract, the agonists progressively relaxes, producing a smooth movement. For example, in the triceps brachii, the triceps brachii are the main antagonists of the biceps brachii. So these are examples. Of course, then we have other group functions of skeletal muscles. So let's continue. So the other group functions of skeletal muscles, we have the synergistic. Okay, so muscles are synergistic. Skeletal muscles are synergistic. Why? Because they prevent movement of intervening joint when a prime mover passes over more than one joint. Okay, then they also complement the action of the prime mover. So from I'm sure you have come across the word synergism. Okay, so it just means complement the action of the prime movers. Okay, but specifically they prevent movement of the intervening joint when a prime mover passes over more than one joint. For instance, the wrist extensors synergizes the flexors during finger flexion by stabilizing the wrist joint, so thereby complementing the action of the prime movers. Then we have fixators. So fixators steady the proximal pass of a limb while movements are occurring in distal parts. Okay, that's what happens. Then in abduction of the arm, the scapula, which is where the attachment of the deltoid is held fixed by several muscles like the trapezium, subclavius, pectoralis minor, etc. So these ones are known as fixators. Okay, let's move. Then you have muscles of the head that produce facial expression. So now we are now starting compartments. Okay, so one compartment which we are going to go through is we are going to go through muscles that are found in specific body regions. And since we didn't find what a compartment is, so a compartment is when we have a group of skeletal muscles, okay, that actually have the same blood vessel, same innervation, and they have a similar function. So when they are grouped together, we call them a compartment. Meaning in the cuff region, we have the compartment there. Okay, that's a compartment. Okay, so now let's start with the muscles that are found that make facial expressions, muscles of the abdomen, and etc. So specifically, let's start by muscles of the head that produce facial expressions. So one muscle is the occipital frontalis, which is the scalp muscle. The other muscle is the orbicularis oculi, which closes the eyes. Then we have the levator palpebrospidalis, which elevates the upper eyelid. Paralysis leads to complete ptosis. Then you have the buccinator, which is used when you want to whistle. So I don't know why I'm not very good at whistling. So So I think that's the highest I can go, and it's only type of whistling I can do. Okay, but okay, let's move. So maybe my buccinator muscle is weak. Okay, then you have the orbicularis oris, which when you want to pace the mouth. Okay, then you have the zygomaticus major, which lines the which is used when smiling and laughing. Okay, so you can even try to smile wherever you are. So so that you know that actually what I'm using is the zygomaticus major. Then you have the um, platysma. Then you have the zygomaticus minor. We have the corrugator supercilii, procilli, nasalis, levator labii, superiaris, ale nasal. You have the levator anguli oris. You have the risorius. You have the depressor anguli oris. You have the depressor labii inferioris. You have the mentalis. Then you have the auricular muscles, which are the vestigial in man. Okay, and remember, there's what we call the facial nerve, cranial nerve number 7. It's actually the one which even innervates most of these muscles. So the facial nerve innervates most of the muscles here. Okay, so let's move. So this is what we are talking about. These are the muscles we were mentioning. So these are the muscles. So we have the zygomaticus major and the zygomaticus minor. The zygomaticus major, we say it's one which is responsible for smiling and laughing. Okay, so then the buccinator for whistling. So I think you can pause and even just try to locate where most of these muscles are, since we already went through them. So we can just locate to see where they actually are. Okay, so I'm giving you some seconds for you to actually pause. Okay, I'm sure you have paused. I'm sure you paused and I've actually gone through the muscles here. I think we can continue. So let's continue. Okay, so now let's go to the muscles of the head that move the eyeballs, which are the extrinsic eye muscles and the upper eyelid. So there are three pairs of extrinsic eye muscles that control the movement of the eye. Number one pair, we have the superior and the inferior recti. Number two, we have the lateral and the medial recti. Number three, we have the superior and inferior oblique muscles. Then the four recti muscles, so meaning if you combine the superior, inferior, lateral, and the medial, arise from a tendinous ring in the orbit and insert into the sclera of the eye. So these are the four recti muscles that are involved in the movement of the eye. So meaning these are extrinsic muscles. Okay, so we were the same extrinsic muscles, so this is where they are. Okay, this is the lateral rectus, this is the inferior rectus, this is the inferior oblique, and this is the superior oblique. Okay, then this in terms of the front view, this is how it is. So they're responsible for actually moving your movement of the right eyeball in response to contraction of extrinsic muscles. Okay, so these are extrinsic muscles. Okay, so let's make progress. So maybe for easy remembrance, for rectus, remember there are three rectus muscles: lateral, medial, and inferior. Then you have the oblique one. So okay, so rectus, we are saying there are three. Okay, the one that we can actually use to remember. So we have the lateral, medial, and inferior. Okay, then you have another rectus which is easy to remember because of the oblique, which is the superior rectus muscle, and the superior oblique muscle and the inferior oblique muscle. Then together there are two oblique muscles, the inferior oblique and the superior oblique. Then the rectus, they are actually four, but it's easiest to remember these three. Okay, but bear in mind that they are actually four. Well, the lateral, medial, inferior, and the superior. Okay, so if you remember inferior, you have to remember superior. If you remember superior, you have to remember inferior. If you remember lateral, you have to remember medial. So this one are rectus and this one are oblique. Okay, so lateral rectus, medial rectus, inferior rectus, superior rectus. Then that's all. 4 muscles. Then superior oblique, inferior oblique. Okay, so let's move. Then you have muscles of mastication, so meaning muscles that actually are used during mastication, which is of course chewing. Okay, and remember, most of these muscles are actually innervated by cranial nerves. Okay, then specifically these ones are innervated by the cranial nerve number 5. Then for the specific muscles, we have the masseter, temporalis, lateropterygoid, medial pterygoid muscle. So these are the muscles we are talking about. We have the medial pterygoid and the lateropterygoid muscle. Then you have the masseter muscle. Okay, so those are some of the muscles we are talking about, and we are saying they are actually innervated by cranial nerve number 5. Okay, so most of them are. So let's move on. Okay, so muscles involved in mastication. If you remove the masseter, this is the visual that you are going to get. Okay, so the masseter is here and it has been removed off, it has been cut off. So this is what you are going to remain with. So you have the temporalis attaching to the temporal fossa, the coronoid process of the mandible. So okay, since we have removed the masseter, so that's where it's going to attach from. Okay, but if the masseter was here, it would have been on top of the where the on the mandible, and it even goes on top here. Okay, so I think we can move. Okay, so muscles of mastication involved in the deeper region. So in the deeper region, this is how you actually look like. You have the medial pterygoid ear, pterygoid ear, and the lateral pterygoid ear. Okay, and then you have the masseter here, so the masseteric nerve, it actually even passes this side. So this is then now the deep region. Okay, this is the deep region. I think we can also move or the posterior view. Okay, then this is the lateral view. So remember, if we add back the muscles, this is how they are going to look like. Okay, if we add back the muscles. Okay, so we have the designator muscle here of the major pterygoid muscle this side, and of the lateral pterygoid muscle this side. Again, you can actually pause if you want to zoom in, you zoom in, and etc. etc. Okay, then we are done with muscles of the head that does mastication. We go to muscles of the neck. Muscles of the neck, you have the sternocleidomastoid muscle, and you have the trapezius muscle. Okay, the muscles of the neck, you have the this is the muscles of the neck. This is a lateral view. So we talked about the sternocleidomastoid muscle. This is the sternocleidomastoid muscle. This is the mastoid process. Then this is the where the sternocleidomastoid is. So the muscle we call it is sternocleidomastoid muscle. Okay, this is the muscle we are talking about, and this is the trapezius. Okay, these are muscles of the neck in the lateral view. So since we are not going to go through all of them, you can actually just try to pause and go through. Okay, this is the anterior and lateral cervical muscle, so meaning the anterior view. This is how it looks like. Okay, this is the anterior view. Okay, this is the anterior view. Okay, so you can even pause and even go through the anterior and the lateral cervical muscles. Remember trapezius and the sternocleidomastoid muscle, and as well as these other ones. Okay, the smaller ones. Okay, so these ones. Okay, this one here. Okay, so I think we can move on. The muscles of the trunk. Okay, so trunk, you have the first we're going to start with muscles of the back. Okay, muscles of the back. Okay, muscles of the back. Then these are trapezius. So the trapezius is actually can found in the neck. So the trapezius muscle which is in the neck, and one which actually goes down in the back. This is the trapezius. Okay, then our latissimus dorsi. The latissimus dorsi is this muscle of the lateral one, and the one on the right side and one on the left side. Okay, then you have the teres major and you have the sacrospinalis, which is the erector spinae. Okay, these are the muscles of the specifically on the back. Okay, so I think you can pause and even go through. So let's move. Okay, so this is muscles of the back, intermediate layer. So intermediate layer, at least you can appreciate some of the muscles here. Then this is the now the deep layer. Again, this is if you were to remove most of the intermediate layers, this is how the deep layer is going to look like. Okay, so we have the erector spinae muscle this side. So the erector spinae muscle is made up of the biconate muscle into longitudinalis, the spinalis muscle, then together they make the erector spinae muscle. Okay, talked of the trapezium. So these are muscles on the back, the intermediate layer and the deep layer. We can actually pause and even go through all of them. Okay, since we can manage to necessarily go through all of them at once in the tutorial. Okay, then we have now the anterior trunk. Okay, the anterior trunk. So and again, the anterior trunk is also made up of a lot of muscles. Okay, so we have the pectoralis minor, pectoralis major. Okay, we have the teres anterior. Okay, we have this is the trunk. Okay, that's the muscles of the trunk, and on the abdomen. Okay, and on the abdomen, these are can be found on the abdomen of the rectus abdominis muscle. Okay, of the rectus abdominis sheath. So this is the rectus sheath. Okay, but this then this is the anterior thoracic wall. Okay, and this is the deeper layer after we cut off the pectoralis minor and major and the serratus anterior. Okay, then this is what we are going to remain with. Okay, so this is the anterior thoracic wall. Then the lateral thoracic wall will look like this. Okay, we have the teres major muscle this side. Okay, then you have the serratus anterior muscle this side. Okay, this is the lateral view, and you can actually appreciate the intercostal muscles. Okay, so this is the lateral thoracic wall. Okay, then you have the respiratory diaphragm, thoracic surface, and the respiratory diaphragm, the abdominal surface. So the thoracic surface, when you actually cut it off from the thoracic region, and this is when you cut off from the abdominal region. So from the thoracic region, this is how it's going to look like. Okay, this is how it's going to look like, and from the abdominal region, this is how it's just going to look like. Okay, so then show this is our diaphragm here, and even here this is our diaphragm. Okay, so this is the thoracic surface, but we now went to the diaphragm. Okay, so this is where the diaphragm is. So the diaphragm, this is the diaphragm, which is here as well, the thoracic surface and the abdominal surface. So you can even pause and try to go through some of the muscles that are actually found here. Okay, so let's go. So muscles of the anterior abdominal wall, muscles of the anterior abdominal wall. Okay, we have the, so they are now the thoracic, we are done. We are now on the abdominal wall. So abdominal wall have the external oblique muscle, internal oblique muscle. the transversus abdominis, the rectus abdominis. Then functions include to protect the abdominal viscera, to move the vertebra, to assist in forced exhalation, even urination, defecation, and as well as the labor. These are functions of the anterior abdominal wall. Okay, then this is the layers of the anterior abdominal wall. Okay, from the skin to the below the skin of the superficial fascia, where we have the fat and the membranous layers. Then after that, we are going to find the muscles. We are going to have the external abdominal muscle. We have the internal abdominal oblique muscle, the oblique muscles. Then you have the transversalis abdominis muscle. Then you have the transversalis fascia. Then after the transversalis fascia, we are going to find the extraperitoneal fascia. Then after the extraperitoneal fascia, then that's finally we reach the peritoneum. That's now the areas of the anterior abdominal wall from superficial to deep. Okay, so let's move, and these are just rectus abdominis muscles in between. Okay. Okay, so these are the muscles. Okay, so we have the strong midline tendinous cord extending from the xiphoid sternum, xiphoid process of the sternum to the symphysis pubis, which is called the linea nigra. So it's actually a line which extends from the xiphoid process to the pubic symphysis. So we call it the linea nigra. It divides the abdominal wall longitudinally and identical. In the anterior abdominal, all muscles flex they flex the vertebral column in the lumbar region, while rotation of the trunk is by one side contraction of the muscles. Then we have the posterior abdominal wall. So the posterior abdominal wall is made up of muscles. So until we are done, we have the posterior abdominal wall, we have the psoas major, the quadratus lumborum, we have the iliacus. So this is now the posterior trunk. Okay, this is the posterior for the posterior abdominal wall, the internal view. Now this is the internal view. Okay, so that's how it is. I think you can make progress. Then we go to the groin. So the groin, we have the inguinal region, which is the area of junction between the anterior abdominal wall and the thigh. So in this area, the abdominal wall is weakened from changes that occur during development, and the peritoneal sac or diverticulum, with or without abdominal contents, and can therefore protrude through it, creating an inguinal hernia. This type of hernia can occur in both sexes, but it is most commonly in males. Okay, so that's about the inguinal region, the groin region. Okay, so this is the inguinal region, and of course the femoral region here, as well as the femoral region. So this is how it is. Okay, so this is the inguinal ligament passing through here. Okay, so the inguinal ligament. Okay, so again, you can actually pause and try to even go through most of the structures, but remember these are the ab abdominal muscles. So these are the abdominal muscles of the inguinal ligament here. Okay, then you have the rings. So we have the deep ring, here, and you have the superficial ring. Okay, so these are some of the structures that can be found. Then you have the the blood vessels as well. We all have the inferior gastric artery, okay, passing through the inguinal and inguinal region. Okay, so I think we can make progress. Then this is the inguinal region. So Remember, during embryology, of course, the testes are found in the is actually one of the retroperitoneal in the retroperitoneal region. So they actually have to descend from the retroperitoneal to go into the testes. So this is how it actually moves. So when it is moving, the testis is this side in the retroperitoneal region. Okay, then it has to move in the gubernaculum, and it has to find itself. So after, when it is moving, okay, the air is going to move into, you have the processus vaginalis, then it will go and even descend right into the testis, okay, into the scrotum. Okay, that's the movement, the descending of the testis. So the growing as a canal called the inguinal canal, whose contents are, so in the males, the growing canal has a spermatic cord in male. Then in females, we only have the round ligament of the uterus. Then in both, we have the genital branch of the genitofemoral nerve. So let me repeat here, since there is a problem on the slide. So okay, so there's a, you can pause from this side. Okay, so what we are saying is that in males we have the spermatic cord. Then in females we have this now in females, which is a round ligament in the uterus. Then in both, okay, in both we have the genital branch of the genitofemoral nerve. Okay, so that's what we have. Okay, then in both males and females, we also have the inguinal nerve, which enters the canal via the interval between the external and the internal oblique muscles and pass out via the superficial inguinal ring. Okay, that's the one which we need to also understand. So this is now in male. So we have the spermatic cord E, and these are just the contents of the spermatic cord. Okay, so that's what we have. Then the content of the spermatic cord follows the rule of threes. We have the three fascias, the three nerves, three arteries, okay, and three veins. So three nerves, three arteries, and three veins. These are found within the spermatic cord. In terms of the fascias, we have the external spermatic fascia, we have the cremasteric fascia, we also have the internal spermatic fascia. Okay, then in terms of arteries, we have the cremasteric artery, which is highlighted in red. That's the cremasteric artery. Okay, then you have the artery to the vas deferens. So you have the artery to the vas deferens. Then we have the testicular artery. So we have three. Okay, the artery to the vas deferens, cremasteric artery, and the testicular artery. Then the veins actually correspond, the names correspond to the arteries. So in short, we have the testicular vein, the cremasteric vein, they correspond with the arteries, but together they form what we call the pampiniform plexus. Okay, then we have the nerves. The nerves, we have the sympathetic nerve, we have the ilioinguinal nerve, then we have the genital branch of the genitofemoral nerve. Those are nerves. Okay, so I think we have actually gone through the contents of the spermatic cord. Okay, those are the contents of the spermatic cord. Okay, then in the inguinal region, if you dissect the inguinal region, this is what we are going to find. Okay, then you have the anterior superior iliac crest. Then from the anterior superior iliac crest, you have the inguinal ligament, and then you have the iliopsoas muscle this side. So these are some of the things you can actually find, but it is actually very bulky, so you can actually just pause and even go through some of these muscles. Okay, so this is the anterior abdominal, the superficial dissection. This is how it's going to look like if you do a superficial dissection. So we have the rectus sheath. You have the inguinal region here. This is the this is the spermatic cord. This is the testis in males. Okay, then you have the anterior abdominal or the intermediate dissection. So this is the intermediate dissection now. Okay, so we can actually even pause and go through because it's actually very bulky. Okay, so this is the anterior abdominal wall, the internal view. This is the internal view of the anterior abdominal wall, and this is the posterolateral abdominal wall. Okay, so the posterolateral. Okay, this is how it looks like. Okay, again we can pause and even go through. Then you have the muscles of the pelvic walls. Muscles of the pelvic walls. You have the obturator internus, you have the piriformis, you have the lateral, you have the levator ani, which has 3 parts. Then you have the pubococcyngus, you have the puborectalis, you have the iliococcyngus, you have coccyngus, or the ischiococcyngus. Okay, these are muscles of the pelvic wall. The muscles of the pelvic wall. So this is the pelvic diaphragm, okay, for the female, and this is also the pelvic diaphragm for the female as well. So these are the muscles of the pelvis, okay, but this is how they are, okay, but this is in females because this is the rectum and this is the vaginal opening, and then this is the urethra. Okay, so this is the rectum, vagina, and the urethra. Okay, those are the muscles involved. Okay, so the sacrococcygenius ligament is this part. Then you have the piriformis muscle, which is here. Okay, then you have the piriform muscle again this side. Okay, you have the sacrococcygenius muscle this side. So these are the muscles. That's why I said you can actually even just pause and actually go through. Okay, so let's move. So this is now for the male part. Remember, for the male part, of course, we are going to have the rectum, then the urethra this side. Then, of course, this is this is not entirely for the pelvis. This is just the gluteus maximus. The muscles of the pelvis start from this side. Okay, where we have the sacrococcygenius, the pubococcygenius, and the so this make up the levator ani muscle. So we have 3 parts. So these 3 parts, 1, 2, 3, they make up the levator ani muscle. Okay, then you have the coccygenius muscle this side as well. So these are muscles powered for the male pelvic diaphragm. Okay, let's make progress. We can go to the muscles of the shoulder. Muscles of the shoulder. So muscles of the shoulder are the trapezius, latissimus dorsi, levator scapula, rhomboides major, rhomboides minor, deltoid, supraspinous and infraspinous, the teres major, and the subscapularis. Okay, and remember, if you want to do injection, so if this is the shoulder, okay, so this is the shoulder, okay, and this is the arm, okay, if this is the arm and want to inject, so the deltoid muscle will be somewhere this side. Okay, forgive my drawing. The deltoid muscle will be somewhere this side. So if you want to inject someone medication, you can actually go 4 centimeters below. Okay, 4 centimeters. Okay, 4 centimeters below and inject here. Okay, so if you want to give your IM in the deltoid, this is actually how you do. Okay, this is the shoulder on top, then you go 4 centimeters below, then the deltoid will be here, then you inject through the deltoid at 90 degrees, and after you inject, don't rush to pushing the medication. You actually have to aspirate to see if you're not in a blood vessel. Okay, then after you aspirate, there's nothing coming out, there's no blood, then that's when you can inject. Okay, so that's when you can administer the medication that you want to give. Okay, so let's move. So we have muscles of the shoulders, the muscles of the shoulders. This is the deltoid. So from this side, okay, you put from this side, then you go 4 centimeters below, then you inject from this side. So start from this side, then 4 centimeters below. So we are talking about, so we do this, okay, then 4 centimeters below, which will be somewhere here, of course. Okay, then you will do your injection. You give, then you aspirate just to see if you're not in a blood vessel. Then if nothing's coming out, then you inject your medication. Okay, that's what you are talking about. So these are the muscles of the shoulder. So I think we can make progress. We can move. So this is the deltoid muscle, the trapezius muscle, the infraspinous fascia here. So this is the deltoid. Okay, we can move. The rest major again this side, and this is the infraspinous muscles this side. Okay, then this is the anterior view. So this is from the anterior view. We have the stem deltoid muscle, the deltoid pectoral triangle is this part. Then this is the cephalic vein. This is how it passes. Okay, then of course these are most of the muscles that we actually even discussed in the shoulder. Okay, so I think we can move on. Okay, so then we can move on to the pectoralis muscles, the pectoral muscles. The pectoral muscles, we have the pectoral major and the pectoral minor. We have the subclavius. We have the serratus anterior, which is if you have paralysis of the serratus anterior, it may lead to undue prominence of the inferior angle of the scapula. Then in the arm muscles of the arm, the anterior, which is the flexor compartment. Okay, we say compartment is where we have group of skeletal muscles that actually have the same nerve supply, blood supply, and have a similar function. Okay, so the anterior compartment of the arm, we have the biceps brachii and the brachialis. Okay, then also have the coracobrachialis, and nerve supply is the musculocutaneous nerve. Okay, then you have the posterior, which is the extensor compartment. You have the triceps brachii and the anconas. Okay, nerve supply of the radial nerve. So it's the posterior compartment, which are the extensors, then the anterior compartment, which are the flexors. Okay, so these are muscles of the rotator cuff. So rotator cuff muscle. Okay, rotator cuff muscle. The subscapularis muscle here. Okay, and you have the infraspinous muscle here. Okay, so these are the muscle, and these of the supraspinous muscle on top, muscles of the rotator cuff. Okay, so these are the muscles of the rotator cuff. Okay, so rotator cuff, there are 4 muscles in number. You have the supraspinous, the infraspinous, teres minor, and the subscapularis. All except the supraspinous muscle rotate the humerus. Then the supraspinous abduct the humerus. Then these muscles protect the shoulder joint and give it stability upward. The joint easily dislocates downwards due to absence of their attachment downwards. So that's why it dislocates downwards. Okay, so this is the rotator cuff muscles, the supraspinous, infraspinous, and the teres minor and the subscapularis. So our mnemonic here would be so let me rub again. Okay, this is SITS, sits, supraspinous, infraspinous, teres minor, and the subscapularis. Okay, so muscles of the arm, they have the anterior view. Okay, the anterior view of the biceps brachii and the brachialis. Okay, the muscles of the arm, okay, in the anterior view. Okay, then you have the posterior view, which is superficial layer of the triceps brachii. Okay, then you have the teres major, this on the lateral side. Okay, then these are the muscles we need to know in the arm, in the posterior part. The long head of the triceps brachii is this side, and the lateral head would be this side. Okay, the muscles of the anterior surface of the forearm. So we are now on the forearm. Okay, so this is where we have flexors of the forearm. Okay, so in the anterior surface of the forearm. So the surface of the forearm has the pronator teres, the flexor carpi radialis, the palmaris longus, the flexor carpi ulnaris, the flexor digitorum, you have the superficialis, you have the flexor digitorum profundus, you have the flexor pollis longus, you have the pronator quadratus. Okay, then you have muscles of the posterior surface of the forearm, which are the extensors of the forearm. You have the brachioradialis, the extensor carpi radialis longus, you have the extensor carpi radialis brevis, you have the extensor digitorum, extensor digit minimi, you have the extensor carpi ulnaris, then you have the abductor pollis longus, then you have the extensor pollis brevis. Then you have the extensor pollis longus, then you have the extensor indicis. Okay, so these are muscles of the flexors of the forearm and extensors of the forearm. So this is the forearm. Okay, so we are done with the arm. Now we are on the forearm. This is where we have a lot of muscles. We have the extensor carpi ulnaris, the flexor ulnaris muscle. We have a lot of muscles we can just even pause and go through. We have the extensor pollis longus. There we have the extensor pollis brevis muscle. We have the abductor pollis longus muscle. We have the extensor digitorum muscle. So these are the muscles we have from mentioning. Okay, then this is the muscle of the forearm anterior view, but the superficial layer. You can even pause and go through. Okay, then this is for the wrists. Okay, and okay, so the forearm, I think we have done our share of the forearm. So then for the hand, we have again we have also a lot of muscles in the hand. Okay, we have the thinner muscles. You have the the palm. We have the deeper palmar branches. Okay, we have a lot of structures, so that's why I'm actually mentioning and stopping, because I don't want to mention almost everything here. So this is for the palm. Okay, after you're done with the palm, we need to go, after you're done with the hand, we need to go to the gluteal muscles. The gluteal muscles, we have the gluteus maximus. Okay, gluteus maximus, we have the gluteus medius, gluteus minimus, the piriform, obturator internus, gemelli, superior and inferior, quadratus femoris, tensor fasciae lati. Okay, so you have the gluteus maximus here, the gluteus minimus here, gluteus medius here, the piriform, the quadratus femoris here. Okay, so this is the okay. Then you have muscles of the thigh. Muscles of the thigh, you have three compartments: of the anterior compartment, the middle compartment, and the posterior compartment. So the anterior compartment, the middle compartment, and the posterior compartment. So this is the posterior compartment, middle compartment, and the order of this is the anterior compartment. Okay, the anterior compartment of the thigh of the sartorius muscle. Then you have the quadriceps femoris, which of course has four muscles. So we are talking about the rectus femoris, vastus lateralis, vastus medialis, vastus intermedius, and all of course are innervated by the femoral nerve. Then 3 we have the iliopsoas muscle. Then you have the psoas major, which is innervated by the anterior rami L1 L3. Then you have the iliacus, which is innervated by the femoral nerve. This is muscles of the anterior compartment of the thigh. Then the posterior compartment, you have the semimembranosus, you have the semitendinosus, you have the biceps femoris, which is the long head, you have the abductor magnus, which is where they have the ischio and the hamstring muscles. So these ones are also known as the hamstring muscles, the posterior compartment hamstring. Okay, then these are innervated by the tibial nerve of the sciatica nerve, except for the head of the biceps femoris and short head of the biceps femoris is supplied by the common peroneal nerve. Okay, so these are the muscles of the hamstring. So semimembranous, semitendinous, biceps femoris, abductor magnus, the muscles of the posterior compartment. Okay, the muscles of the medial compartment, which are the abductor compartment, we have the abductor longus, adductor longus, adductor brevis, adductor magnus, of the gracilis, the pectineus, obturator externus, nerve supply of the obturator nerve, whose dorsal divisions, which is the dorsal divisions of the ventral rami of the L2, L3, L4. Then you have the hamstring part of the abductor magnus, which is supplied by the tibial nerve. Okay, this is the anterior view. Okay, but we remember we divided the muscles here into the anterior compartment, medial compartment, and the posterior compartment. Okay, so this is the anterior view, of course. So most of these are found in the anterior compartment. So in the anterior view of the muscles, you have the iliopsoas muscle here, you have the sartorius muscle here, and you have the rectus femoris muscle, rectus, remember, straight, rectus femoris muscle. Then you have the vastus lateralis muscle, and you have the vastus medialis muscle. Okay, at least these ones are easy to remember. Then you have the gracilis muscle is this side. Okay, then this is a deeper dissection. After we now do a deeper dissection, okay, you have the gracilis muscle, the adductor longus muscle, then you have the pectineus muscle this side. Okay, from the deepest dissection, again, this is another view on the deepest dissection, which we can pause and go through. Okay, then you have the iliopsoas major this side. This is the iliopsoas major. Okay, so this is the psoas major muscle. Okay, as you have seen, the psoas major muscle. Okay, the muscles of the hip and thigh. Okay, this is the muscles of the hip and thigh, but this is the lateral view. Okay, you can actually pause and go through. This is of the gluteus muscles, the gluteus maximus. This is the gluteus maximus muscle here. Okay, then you have the longus head of the biceps femoris muscle. You have the sartorius muscle this side. To the lateral view. Then let's go to the posterior view. Okay, then in terms of clinical application, so remember, since we said you have the sciatic nerve, which passes, okay, this is where the buttock is. Okay, if this is where the buttock is, okay, if this is the buttock, okay, and we have the, okay, we have the maximus, the gluteus minimus or maximus muscle passing this side. Okay, remember, if the sciatic nerve is going to pass this side, we have to do you have to do a division, so where we divide into 4 quadrants. we have the upper inner, lower inner, then outer inner, and upper outer. Okay, so in terms of now you doing injection, IM, intramuscular injections, you actually have to inject in the upper outer, so meaning you actually choose this in order to avoid the nerve which was passing this side, this nerve. Okay, this is the nerve, then you want to avoid it, so we choose the upper outer. So in terms of ear, we are actually talking about injecting from this side. Okay, injecting from this side, this is the upper outer. Since if we want to make a quadrant, this is how we're going to make our quadrant. Okay, then the upper outer quadrant would be this side. Clinical application, IM injection in the gluteal region. Okay, this is how we do it. Okay, I hope it has made some sense out of that. Okay, so this is muscles of the posterior view and some clinical application of the posterior view. Okay, then this is the anterior view. This is the anterior view where we have the psoas and iliacus muscle. So this is the psoas major. Okay, that's the psoas major. Okay, let's move. Then we have leg muscles. Leg muscles, in terms of compartments, we have touched some of the okay, leg muscles. We have touched some of the definitions for compartment. Also, what are extensors, what are flexors. So for the leg, we have three compartments of the anterior, lateral, and the posterior compartment. The anterior, which are the extensors, have the nerve supply, which from the deep peroneal nerve, anterior supply from the anterior tibial artery. Then the lateral fibra, the lateral, we have the fibra and the peroneal, where we have the nerve supply from the superficial peroneal nerve, we have the anterior supply from the peroneal artery. Then the posterior flexors, we have the superficial compartment, which is the deeper compartment. We have the superficial compartment and the deeper compartment. The deeper compartment supply the nerve supplies from the tibial nerve, anterior supplies from the posterior tibial artery. So this is for the nerve supply and the arterial supply. At least a recap on the anterior and the nerve supply. Okay, so this is a cross section of the muscles in the middle of the leg. Okay, this is the tibia and this is the fibula. Okay, so compartments in the legs, in terms of the muscles. Okay, since we have already discussed to say of the extensor, the lateral, and the flexor compartment. So in the flexor compartment, we have in the extensor compartment of the tibialis anterior, the extensor hallucis longus, we have the extensor digitorum longus, of the peroneus statichus, that's the extensor compartment. Then the lateral compartment of the peroneal longus, the peroneal brevis. Then the flexor compartment of the gastrocnemius, the soleus, the plantaris. Then in the deep muscles, we have the popliteus, the flexor digitoris longus, the flexor hallucis longus, and the tibialis posterior. Okay, so these are compartment muscles in the leg. So in the leg, you have the extensor muscle, the extensor compartment, lateral compartment, and the flexor compartment. In the flexor compartment are the superficial muscle and the deep muscles. I think we can make progress. Let's move. So these are muscles of the leg we are talking about. Okay, then this is where we have the anterior view. Okay, we are talking about the tibialis anterior, the peroneus longus muscle. Okay, then you have the soleus muscle. Okay, so this is the anterior view. Okay, so this is the anterior view we are talking about. Okay, so the tibialis anterior muscle this side, then the fibralis longus muscle, the fibralis brevis muscle. Okay, these are the muscles. Okay, then this is another view, okay, for the anterior aspect. Okay, then the posterior view, these are the gastrocnemius muscle. These are the gastrocnemius muscles. Okay, but this is the superficial dissection. So of course, the gastrocnemius muscle will be very prominent here. Then this, after we remove the gastrocnemius muscle, then at least you are going to see other structures. Okay, so after removing the gastrocnemius muscle, this is the gastrocnemius muscle that was removed. Okay, so this is the posterior view. Okay, so this is how it is. So there are a lot of pictures for you to actually even pause and go through, because this is actually a very bulky lesson on the muscles. Okay, the lateral view. Okay, this is the lateral view. So we have the soleus muscle. Okay, we have the gastrocnemius muscle. Okay, so this is the muscles of the lateral view. Okay, this is also the lateral view of the fibralis longus, the fibralis brevis. Okay, the muscles of the sole of the foot. This is the second layer. So this is for the foot of the abductor digit minimi muscle. Okay, you have the flexor digit minimi brevis muscle. So we have a lot of muscle. We have the lumbrical muscles. Okay, we have the flexor muscles, the flexor digitorum longus muscles. Okay, so these are muscles that make up the sole of the foot. Okay, okay, so I think let's move to so these are the tendon and sheath of the ankle. So we have the tendon, sheath of ankle. So these are the tendons and sheath of the muscle. So we have the sheath of the tibialis posterior tendon. Okay, you have the sheath of the tibialis posterior tendon this side. You have the tibialis posterior tendon this side. So this is on the ankle. Okay, so we have these are the malleus, the medial malleus of the tibia and the subcutaneous bursa. So these are the malleus. Okay, so let's move. We can actually even pause and go through. Okay, so this is the posterior view. Okay, this is the posterior view. We have the abductor iris, the flexor iris brevis, the plantar interossei, the flexor russei brevis, and quadratus plantae. Okay, then that's actually all there is to the muscles. So in summary, okay, in summary, let's now do a summary. In summary, there are actually 640 muscles in the human body, but the principal skeletal muscles which are responsible for movement and support of the skeleton are somewhere around 400. Okay, somewhere around 400 muscles. So actually what we have gone through, we have gone through 400 muscles. So the same 400 principal skeletal muscles can be further divided into, we have 126, so 126 muscles in the upper limb. So we have in the upper limb, so 126 upper limb, upper limb. Okay, meaning the shoulder, arm, forearm, wrist, and the hand. 126. Okay, then 128 can be found in the lower limbs, lower limbs. Then so lower limbs, we're talking about the hip, thigh, leg, ankle, and the foot. Okay, then the other 64 muscles, 64 can be found in the trunk. Okay, trunk. Okay, in the trunk. Okay, so we have the back, abdomen, and the pelvis. Then you have 82 muscles in the head and the neck. So H and N. Okay, so head and neck, you have 82 muscles. 82, 64, 128, 126. There are a lot of muscles. But you also have to note that some sources may group muscles differently, and some muscles may be considered subsidiary and accessory muscles. But you have to know that 400 is actually a very commonly cited estimates for the number of principal skeletal muscles. So in short, we are saying you can find another literature which actually says maybe we have to give out a different number in as apart from the one we have mentioned. Okay, hope we are together on that point. Okay, I think that's all on the recap. Then the other thing you just have to know is that definitely you have to know how the various ways. Okay, various ways. Okay, I'm trying to write various very quick. Okay, so various ways. Okay, I'll just write W. Various ways of naming skeletal. So naming skeletal muscles. So we need to definitely have to know the various ways of naming the skeletal muscles. So this is a very important question. Okay, so we definitely have to understand. Okay, definitely have to understand. Okay, then we are done. Thank you for watching, and if you haven't subscribed, please subscribe and hit the bell notification. And of course, see you on the next